think we've seen an increase in countries increasing their own domestic financing towards HIV, which has been really useful for our advocacy efforts here, because we've often had that come back from governments to say, well, if domestic funding increases, then we would be more prone to supporting that. So we've seen that. We've heard the message for some time, and your message today about how essential it is to know your epidemic, and the importance of hubs or key populations, and the epidemiology and where infections are growing and in all of that. So what does the Global Fund do in countries that are resistant to that and don't want to recognize key populations such as MSM and sex workers? And I know that I know that the Global Fund is providing the funding and is not in a position to kind of hold them or force them to do anything, but it's a serious question around countries that won't recognize the importance or the role of or even the existence of some key populations.
So it's an excellent question. I would point out that countries are increasing their contributions for HIV, TB, and malaria. And in fact, TB is dominated by domestic contributions because it's driven by Asia and India and other places. So we're seeing those contributions go up across the board. So on the human rights issue, there are a couple things. One is governments aren't countries. Countries are countries in all the sectors, and that's why, for example, in Eastern Europe, we work with civil society because we're not going to see governments moving on some of those populations or haven't. And then there are populations like prisoners where TB is rampant and very difficult to work with, and because it's actually the easiest population in many ways to work with because they're kind of captive. You don't have to go out and find them. But a lot of governments aren't interested in working with those populations. So I actually think the solution in this comes with the epidemiology. If you go to any government that has resistance and say you must deal with these populations because it's a violation of human rights, they're never going to. You can say it as many times as you want. And that's not our role. We're not fundamentally a human rights organization. We're fundamentally a health organization, and we see human rights through that lens. And that's what our board has asked us to do and is in our strategy. But in many ways, that provides an opening that you don't have if you're just a human rights advocacy organization. And it all comes down to the data. So what we have seen, including in Kenya, Nigeria, South Africa, Namibia, Botswana, is if countries see data on, and you get the epidemiology on where the infections are, who's at risk, and the reason we need to deal with these populations, and you need to deal with these populations because you're not going to contain your epidemic unless you do, they start moving. That's a different approach. It's a fundamentally different approach, but I think it gets to a much more rapid advance in human rights. And I think we've actually seen that. We've seen that in this part of the world, where maybe not in Canada, but gay rights has moved heavily because of response to HIV and HIV. And in a similar way, we can start to address issues related to girls and women, to sex workers, MSM, people who inject drugs, and prisoners with that approach. And that's what our board has asked us to do. And I think that that's going to have a change. Human rights change can take generations, but crises can flip that. And I think that we are actually in a position with the data to change that. And that actually gets to, so a lot of countries don't have district by district data or don't have key population data yet. But we can say that to get to a concept note today, it's important to have those data, or you can't possibly know what interventions are going to work or where to target them or focus them. And so you can take money out of the grant, you can work with other partners, you can do your allocation before a grant is signed because you have an allocation. That's different than the funding model. You couldn't do that before because you know what your envelope is. Or other partners can fund that, but we can't really move forward together. You can't have an impactful program without having those data. And I think it's the data that's going to drive everything. But it's going to, again, it's going to require civil society, it's going to require on-the-ground advocacy, it's going to take a much different approach than we've had, and a different view of what a health system is, that it doesn't end at the clinic.
Hi, I'd like to build on that. I have a T-shirt that says "Older Women Count," and it's a double entendre because we not only count, they aren't counted in the HIV/AIDS, till very recently, past age 49. And the grandmothers in Africa that we work with, I've got two concerns here. Number one, they're not counted. Many of them are HIV positive, and nobody knows and nobody cares, and they're the last ones to get the treatment. Many of the children in their care are HIV positive. They're the poorest of the poor, particularly living in the rural areas. So when you say it's really important to have the right voices at the table, one of our concerns is that that voice is not there. It's ignored. And so in Canada, the grandmothers, we hope to stand in solidarity and provide that voice, but we obviously can't do that in African countries. There are some really good older women grandmother advocacy groups, but they're small. So I don't know if there's any way that you can help make sure that voice gets to the table, but that would be one of our asks, one of our appeals.
We're a little bit limited, unlike bilaterals. I mean, it does have to be groups in country that are there to come to the table. We can convene. We're actually brokers, and we're retraining our portfolio managers and people who go in the countries to be brokers. We are not a technical agency. We have no in-country presence. So we really have to rely on others to say there's this organization and these organizations. And so I don't know who those organizations would be. You would have to help funnel that through to our portfolio managers. Through other organizations or through your own network to make sure that that's taken into account. My suggestion would be to take a country by country approach because you're never, it's very difficult globally.